do I have permission to palpate some of the structures of your knee?
Yes.
Okay, thank you. And so starting off with the condyles of the femur, what we'll do, we'll come from the patella, just slide a little bit off to the side here, and we'll be able to palpate for the condyles of the femur. Moving up just a little bit proximal, we'll then be able to palpate for the epicondyles of the femur. Coming back to the patella, we'll just trace the outline here, starting with the base, working our way down to the apex. And then from there, from the patella, we'll be able to slide a little bit superior and palpate for the trochlear groove, where the patella tracks as you flex and extend your knee. Sliding a little bit inferior from the patella, we'll be able to palpate for the patellar ligament as we work our way down to the tibial tuberosity. If we come up to just to the side of the tibial tuberosity, we should be able to palpate for the head of the fibula, and we can kind of grasp our fingers around the anterior and posterior aspect of that. From the tibial tuberosity, we'll work our way down the shaft of the tibia, and then we'll also identify tibialis anterior, the muscle. And so tibialis anterior starts off the lateral side of the tibial shaft, works its way down to the medial aspect of the foot. And so what I'll do is I'll come down a little bit on the tibial shaft, slide over just to the side of the shaft here, and then we know this is a dorsiflexor, so I'll have the patient bring their toes to their head here. And I should feel a contraction right there. We'll now find extensor digitorum longus. And so we can take a look at some of the superficial tendons of extensor digitorum longus. And from here, I can just kind of palpate, working my way up. And extensor digitorum longus originates just a little bit lateral to tibialis anterior. And so we'll come off shaft of the tibia, work our way just a little bit lateral. And we know that this is going to extend the toes. And so I'll have the patient go ahead and do so. And I should feel a little bit of a contraction. And then to check that we're not on the fibularis muscles, we know that the fibularis muscles help to evert the foot, and so what I'll have the patient do is perform this motion, but against my resistance. So go ahead and do so. Okay, relax, and I shouldn't feel a contraction there.